I'm not going to put something in my own face, you better believe I'm not putting it in 100%. Your face.
You shouldn't be like, oh, I can see you got filler. Like, that shouldn't happen. Like, it should just be very natural.
You know how I remember PDGF?
I don't know. I want to know. Don't do that. That's not okay. Okay.
Welcome to our 9th episode of Hormones Uncorked.
I'm going to put down a finger. It's like when we were in Mexico, when we were in 21, and my best friend was like, I would like 10 shots of tequila. No, she was like, I would like 5 shots of tequila. 5 shots.
You can't see Stacy's hands if you're not watching the video.
No, I put up 10 fingers.
She's got 10 fingers up and saying 5 shots.
2 inches lateral from each other.
The bartender's like, cut her off.
We were in Mexico. Nobody gets cut off in Mexico.
That's true.
We were 21.
That's a good thing about Mexico.
So we're 9th episode. We just did our 8th recording. That's why we backstory. We had a very rainy photo shoot today. Very rainy. It is August 26th. So if you all are thinking about that, there's been rain for 3 days in a row now. We decided to plan this photo shoot for the last 2 months. And in Reno, it rained today.
You know, the place that like we never get rain except for the last
we even matched our outfits, and I'm wearing white.
And it's Reformation. It's
Reformation,
like I said it wrong.
Reformation. They're amazing. They're closer.
Reformation.
I mean, it's very nice quality.
It is.
I really like it.
It's comfy.
Yeah.
So comparable to like, I'm like, it's almost good as Vuori.
It's
almost as good as Vuori.
It's really nice. It actually dried very quickly too.
It did.
Thank you, Reformation, for making our clothing. We really appreciate you.
But we got drenched in water, so looking like a drowned rat.
We had very pretty hair. We were ready to go, and when you see our photo shoot, you'll be like, "Oh, Carrie did a great job, and it's gonna look amazing." I think it's fun.
You know, it's kind of like on your wedding day. They say if it rains on your wedding day, it's like good luck.
Right.
We're going to go with that.
Here's the thing. We just did it anyways.
Yeah, who cares?
Like, Carrie's like, you want to reschedule? We're like, nope. Let's get it done.
It's going to be great. I think authenticity. I'm all about the authenticity. Just let's go. Shit is not perfect around here.
So if you're like, okay, did you guys prepare for today with your hair? We'll be like, yes, we did. A lot. But you can't tell.
No. So. And we both worked today.
We did.
Saw patients.
It's been a day.
It's been a day.
Anyways, today, episode 8. Yes, I keep on forgetting.
I think it's 9. What are you talking about? It's 9.
Episode 9. I'm so sorry. We just recorded episode 8 and it was fun. Episode 9 is all question and answer, which is fun.
Yes.
You guys just get me and Andrea the next couple episodes. And then we want to talk about who we're going to have on the podcast this month?
Yeah, let's do that.
Who are we going to have on the podcast?
I thought you had that planned out, Stacia.
So we're having Allie Janice. She's going to kill me when she hears this, but she's okay with it.
You're doing it, babe.
She's from Great Basin Orthopedics, and we love Allie. Her daughter and my daughter are best friends, Shay, who are also in Andrea's son's class. So it's all very intertwined.
We are all intertwined.
It's very intersexual.
Grayson loves that class.
I know. Miss Krauser's fantastic.
He's like, she's so nice. And he
nice.
Came home already. First week of kindergarten, home biscuit is writing full sentences.
He's in 1st grade.
Would I say kindergarten?
Yes, you did.
It's been a long day.
Do we want to talk about how you lost your way on the way here? No.
No.
He's in 1st grade.
1st grade, writing full sentences.
Yeah.
Like spelling, like pretty good too.
Yeah, Mrs. Krauser's amazing. So Quinn and Shay are in 2nd grade, but our kids have 1-2 combo classes, and so Grayson, Quinn, and Shay are all in the same class. It's great. So anyways, Allie Janice will be here soon, probably the next couple weeks, and she works at Great Basin Ortho. She's been a nurse practitioner for as long as I have, for 16 years. She is all ortho, and she's going to talk about menopause and how it affects your bones and frozen shoulder and all the things. So it's going to be very interesting. We might have Hillary Allen back because she really wants to come back because she is
And I've had so many people.
The smartest human I've ever met in my life. Let's be honest.
I know. And okay, since that episode, you've seen her meal preps.
I've seen her meal preps. I've also seen I can't keep up with you because you're so smart and my brain is not computing right now. And I don't think I'm dumb. Some days might be, but
No, she's super intelligent. She has that artistic eye. Have you seen the photography she takes?
Flowers. I'm like, could you make
amazing.
me a flower bundle?
I need to like bring her artwork in so I can show you guys her artwork. And then also, yes, everybody was blown away with what she had to say. And they were like, hey, I want to know more. I need more info. And
I think
I'm
she's going to list out like meal stuff and like a whole nutritional thing is what she said. So she'll be great. We have a very, very, very exciting people coming on. Andrea and I are pairing with a winery. You'll know who it is when we do it. But they're going to sponsor us for an episode, and it's going to be this big episode on wine pairing and hormones. So it's going to be so fun. And that's just in a few weeks. So question and answer. Oh, I did want to say, so Andrea's got 2 kids. I have 3, but her oldest and my daughter are also in the same class. And Paige, the other day, I have to tell you.
Oh, God. I'm terrified.
No, Easton didn't do anything.
Okay.
But she said, Miss Wilcher, so Quinn Wilcher, that's her name. Oh, yeah. She's fantastic. She said
Easton
she
told me this
out
too.
Easton and I in class and said, did you know your moms are famous? And I listened to them. And Paige was like, the entire class looked at me. And I was like, I'm famous too. I was like, girl, you didn't do anything. You are not famous. Your mom, on the other hand, 1 star.
He did not tell me that this is the difference between boys and girls.
Yes. We love Miss Wilcher. She's fantastic.
We love Quinn.
We love Quinn. She's great.
No, Easton said, yeah, Mom, Miss Wilcher said she likes your podcast. And I was like, awesome. I didn't know she listened. That was the story I got from Easton.
I think maybe she did it in a different class than Paige in a different class too.
Okay.
Like maybe it was different classes. Because they like rotate in their grade. Anyways, you probably don't want to hear this at all, but we're telling you anyway. They like move around in 7th and 8th grade. And she was like, Miss Wilcher said that she listens to you. I was like, I heard. I know. She thinks we're great. She's great too.
She's great. We love Miss Wilcher.
We just love everybody at Snows. It's just, our kids go to Our Lady of the Snows. It's literally the best school.
And it's nice to have the community, right? Mm-hmm. They're like truly, I feel like I almost called him provider. Every educator there is amazing. We love Mr. Fuchs. We love all the people there. We love the community. We love the families.
Yes. I mean, I have to say, like, it's so nice when you know so many of your kids' friends' moms.
Yes.
And you can call or text them at any point and be like, what is going on with this situation? And everybody is responding because they know everything about your child. And people might think that's weird. I grew up in Fallon. It was just a thing. If you got a speeding ticket, your parents knew about it before you got home. So I'm used to that. So I think it's wonderful that people know about my kid, because if they're doing something shitty, I want to know.
Same. Mm-hmm. And yeah, it's good. They do grow up together. They grow together. They have their moments of like, we get along, we don't get along, we get along, we don't get along. From an education standpoint as well, my son has a lot of struggles, and it's nice that he has that community that surrounds him. Mm-hmm. Like at Snows, you don't get an IEP, right? It's a private school. They're not beholden to the same standards. But literally when he was in kindergarten, they were like, hey, we noticed that he needs some support with reading. And so we're going to put him with our speech therapist. And they literally pulled him 3 days a week.
Did he go with Michelle Hurley?
Yes. And I
might
love
be
her
the
so
nicest
much.
human in the world.
For sure. I have so much respect
she is
for her.
Like and I tell her all the time, I'm like, Michelle, Levi loves you. Like, obsessed with her. Like, so am I. She's just great.
And so it's nice. It's like, as a mama, like, you're only happy as your most unhappy child, right? We've all heard that. And
which is very true.
For me, my little one is just very easy. My older one, we have lots more struggles and challenges, and that's okay because that's building grit and resilience and all the things. But it's like, I know he's surrounded with a community that just accepts him for who he is, tries to give him love and support, and also tries to support him in any way that they can. And like, as a mom, that is invaluable.
Yeah, definitely. 100%.
We weren't meaning to talk about our school.
One more thing about the school. Did you know that Levi's class, Mr. Rippingham, he's not going to be listening to our podcast, let's be honest. He has 24 boys and like 28 students total. 24 fifth grade boys.
I think that
this
happened
man
last.
is a saint.
I think that happened when Easton was in that
so
grade
did it
too.
When Paige was in that grade too. I don't know how there's so many boys born in this like 2015 down to 2010 era, but so many boys.
Yeah.
This man is a saint. I saw them on the first day of school and went home and had a drink for him. Yes, I'm like, I am sorry. Bless him.
I think I would like have a taser.
Those kids.
What's that you say?
If anybody can keep them in line, he can. 100%.
Say that again.
Yeah. You can beat my child. It's fine. I'm joking, but.
That old Catholic school ruler.
Bring it back. Bring the nuns back as well. Just put them in Mr. Rippingham's class. That's the only place they need to be because they're intense. Okay, let's talk about
Moving on.
Q&A. First Q&A. Andrea went and got her hair done today. The girls at that 731 Forest were like, hey, we have all these questions. Like we said before, they're some of our very favorites.
Oh, absolutely.
So
I don't know off the top of my head. I thought you said you had more questions on the top of your head. What are the biggest questions you get?
The very biggest question I get is, why am I losing my hair in perimenopause?
Same.
Number one question. Why am I losing my hair? And I think it's a complex answer. So maybe we can give a number of different reasons why. I think that when you're on hormone replacement therapy, and I told a patient this today, hormone replacement therapy, the way that we do it and the way that it should be done is bioidentical hormone replacement therapy. So it's not synthetic. It's not taking down your hormones and then giving you false synthetic hormones and keeping them stable. So you're still having the fluctuations that you will in perimenopause. It's just a little bit better. If you think of it like an ocean wave, we're trying to put your hormones back up to a little bit more of a better balance, but it's not going to be perfect. So because it's natural, it's bioidentical, it's not going to be perfect. So you can still have the hair loss from just perimenopause alone. Testosterone can also cause hair loss. So some of our patients can do 4 or 5 clicks of their testosterone cream and be fine. Some people can do 1 or 2 and not be fine. So it kind of depends on that person too. The strength of the hair follicle, genetics. I mean, everything plays a huge role. If you're on GLP-1s, if you're on high dose GLP-1s, you're not eating your protein. You're not having
nutrients,
a
right?
balanced diet. Then you're going to have hair
veggies.
loss. If you're just using the GLP-1 and just to lose weight and you're dropping weight quickly, your body gets stunned and you will have hair loss as well. So it's kind of a lot of different things. I'm really liking saw pimento, the herb saw pimento for hair loss. I feel like it's working really well. This is not medical information. This is just like, take it how it is. Saw pimento, it's called DHT.
Okay.
And it actually can bind to your androgen portion and help keep the hair follicle more stable. So I feel like that is working really well.
And that's oral, not topical.
That is oral. You do this too, and so do I. GHKCU.
I haven't been doing it. I want to.
No, but you have the peptides. It's a peptide.
Oh, we can get it, but I haven't tried it yet.
It's great.
And that's topical application.
So it's a solution. So you put it in your hair at night like a solution, probably every other night, because you really want to wash your hair every day in the morning because it's a solution, right? Yeah. So you put it in your hair at night. It kind of binds to the follicle and keeps it stronger. I was talking to the pharmacist from the compounding pharmacy, and she said she loves it.
Cool.
So GHKCU, it's called Vital Hair for the company that we use.
And they did mention that you told them, I don't know, it'll be like $50.
Right.
It's $350.
Okay, the reason why, first of all, don't rattle on me, Andrea. The reason why is because when I looked online, it said $50, but that was the 0.5%. And I ordered the 3% and the 100 ml. So
it's fine. We're all learning together.
Do you want your hair or not?
Girl, I will pay. Okay, so here's the thing is I
bought think it's
the
supposed to last like 5 months.
I bought the plated, which is platelet derived exosomes, I believe. But I bought that serum.
What is the brand of that one?
Plated.
Oh, Plated is the brand.
They make skincare and they make a hair serum. And
what is in the hair serum? Is it like minoxidil? Oh, because you can also do like
it's like
prescriptions like minoxidil.
It's like from
finasteride
platelets, right?
Oh, got it. Okay.
But even that serum's $400.
So why are they bitching about that serum?
They weren't bitching. They just said you said it was 50, and then they saw that it was $350. I mean, tomato. If we're being honest.
Sorry, girls. I left out the 3. Also, if you're really having hair thinning, you can see Andrea. She does PRP or PRF, and that is when they go ahead.
Okay. So there's a lot of questions about.
Andrea's very into this more natural way of beauty, which is the best. So we can talk about PRF on my face in a minute.
Okay, so PRP is platelet-rich plasma. We draw your blood, we spin it in a centrifuge, we isolate your healing cells. If you were to get a cut on your body would send your platelets, your stem cells, your growth factors, your fibrin, all the things, right? So in that tube, there is an anticoagulant and there's a gel separator. So when we spin it, your red blood cells are going to be at the bottom. There's a gel separator, and then there's your PRP. But there is an anticoagulant in there. So the pH is a little bit different than your normal pH, okay? It has a quick release of growth factors. And so we primarily use PRP when we microneedle the skin, right? We make tiny little injuries in your face. We put the PRP on top. You leave it on for 2 hours. You wash your face. It helps you heal faster. Okay, that's PRP.
And it helps plump the skin a little bit.
I mean,
with the collagen production, or does it not go deep enough?
I mean, a little bit. It's like, it depends on how deep you're into the dermis.
How deep would you have to go?
That's a really good question. Did I put you on the spot? Like yeah. So I do different depths in different areas of the face. On the forehead, I do 0.5. And the cheeks, I do as much as I do 0.5 on the forehead, 0.5 on the nose, 0.5 under the eyes, probably 1.5 on the cheeks because they're meatier, you know, and probably 1 around the chin and the mouth area. Okay. So, I mean, it's variable, right? But it does
you think that the
significantly improve healing.
You do. You think that works better?
I won't even microneedle somebody without it.
But what about all the new growth factors?
We'll talk about that next.
Oh, she just told me to shut up in a nice way. Go ahead.
Okay, PRF, platelet-rich fibrin. We spin it differently. We spin it shorter. We spin it slower. You get more concentrated cells. So you're going to get more fibrin. You're going to get more growth factors, whatever. You don't yield as much active product. So it has a longer release of growth factors. PRF is my preference for hair restoration and for tear trough. So I don't do tear trough filler. I'm not into it. There's a whole reason.
Well, it can migrate.
I can go on and on and on about why. There's a lot of reasons why. But ultimately for me, I think it's best to just thicken the skin under the eyes. Okay? Hair, PRF, all day. It's just your blood. There's no additives or nothing in the tube. It doesn't burn. It's not painful. It's amazing. Works really well for hair. Now, new to the aesthetics market, I should say, is PDGF, which is platelet-derived growth factors. It is like PRF on steroids. It was made in a lab. They took it and then they replicated it in a lab. It's made just like insulin. And so you take out the variability in efficacy because you're not dependent on age, right? Like if I draw a 70-year-old's blood and spin it versus a 20-year-old's blood and spin it, I'm going to get a very different result. If you have chronic illness, if you smoke, if you drink, all the things, right? Like there is variability in your blood based on where you're at in your life. With PDGF, we take all of that away. It's very measurable, it's very scientific, and it's significantly stronger. That said, there's FDA indication for injecting it in like 5 areas on the body, newer to aesthetics. They named it Ariescence for aesthetics. And instead of mixing it with saline, they were like, what do we mix it with? So they mixed it with hyaluronic acid.
Oh, okay.
Only on label, FDA approved for topical use. So I can microneedle your face with Airy Essence and I can put it on topically.
So you can't do it like
Totally
what
fine.
we did.
That was different. That was
No, but you can't.
No, I can't inject it.
Okay.
Yeah.
Okay. Yeah. I was gonna say it's probably.
Now, what some injectors are doing across the country, and I'm not doing this until I take a course on it. It's a CEU course, right? We only do evidence-based medicine.
Mm-hmm.
Thank you.
Yep.
So some injectors, instead of mixing it with hyaluronic acid, they're mixing it with bacteriostatic normal saline.
Mm-hmm.
And then they're injecting it.
Where?
In the tear trough and in the hair, in the scalp.
Okay.
We're seeing very, very good results. It is 100% off label. However, PDD, no. It's been a long day.
Yeah, she got lost.
And I'm dyslexic, by the
true.
way. You know how I remember PDGF? I
don't know. I want to know.
P. Diddy's girlfriend? Listen, you want to know how you get through nursing school and NP school as a dyslexic? You make weird ass shit to help you remember.
P. Diddy doesn't have a girlfriend anymore. He got a boyfriend in jail.
True. All that to say, PDGF is
P. Diddy girlfriend.
Some injectors are injecting it with saline, not hyaluronic acid. You're doing it down to bone only. There's all kinds of weird stuff that can happen with it. You can get lumps and bumps. You can get, it helps like angiogenesis and tissue repair and rejuvenation.
Nobody knows what that means because you're speaking like I was last episode where you said calm it down. You're speaking too high of terms.
We make new blood cells. We make new cells. We thicken the skin. We do all the things that we want to do. But sometimes with that, you get a little bit like, so people are seeing either like pain, like a lot of pain
with the injection.
Yeah, because like
there's no
your
lidocaine
pain
in the...
going forward, your pain receptors are like on fire, or numbness.
Oh, interesting. Okay.
Yeah, and it's really just like a hypersensitivity of your pain, but it is perceived as numbness. So
I aspirated my wine when you said P. Diddy's girlfriend.
I'm sorry.
It's fine.
It's been a traumatizing few years with
P. Diddy.
Yeah.
Too much.
So when I was in Nashville and I was staying
go.
at my friend Alyssa's house, who has her dog, and I was laying on the couch and I was scrolling through TikTok watching all of these. Listen, I was scrolling through TikTok watching all the stuff about P. Diddy, and I was like losing my mind on the inside. I was like so stressed, and her dog comes up and lays on my chest. And when she came home, I was like, oh my gosh, he knew. She's like, well, yeah, he's a service dog. That's what he's for, is anxiety and stress. And I was like, oh, I didn't know that. Yeah.
That's fun.
It was kind of cool. Anyway, that's my tangent for now.
Okay.
So more to come. I do believe that PDGF, BB, there's lots of clinical studies on it. There's lots of evidence, like 15 years of literature and evidence-based like all the things. But
it can help hair restoration.
It can.
Yes.
And I do believe that it's going to be the next thing
Gold
in
standard.
aesthetic medicine. Okay. We're just like figuring it out still.
I think that's great.
It's really cool.
Yeah.
So that's another thing you can do for hair.
Yeah.
Not injecting it, just microneedling and then getting it in. But here's the thing is the hair follicle is very shallow.
It is, yeah.
So if you make an injury with a needle that's, into that realm, you're going to be fine.
True.
Just get it in there.
Yeah. So I think there's so many different things you can do, but going back to the root cause, why are we having hair loss? Is it genetic? Is it hormonal? Is it nutrients? Is it protein? Is it GLP-1? Like what is going on?
Above.
Yeah. So different ways to look at it for sure. Is it age? I mean, we're all gonna lose
and
some
here's
hair
another
with
thing
age for sure
that we were talking about today is like, I knew this at one point, I'm sure, but like you're supposed to actually brush your hair like 50 strokes a day. Like get your scalp, stimulate your scalp. When you're washing your hair, you don't just wash the hair, you like scrub your scalp because you want that blood flow. You want to stimulate those follicles and bring blood flow to those follicles, which is what you're doing with all of these products. So like if you can't afford any of this stuff, like at least do that focus on your scalp health.
I always tell my girls, because I swear they leave out their scalp. I'm like, you got to scrub your scalp.
Yeah.
You're a greasy dirt
and
ball.
Disgusting. I told Easton the same thing. I'm like, nope, turn around, get back in that shower, scrub your head.
I did. I'm like,
I will
I can see the grease
scalp.
from here. Yeah. Easton and Paige should not sit by each other in class. Smelly scalps. Just joking. She's great. Love her. She's a great kid.
Great kid. It's okay. They're figuring it out.
They are. They're 13, 12 and 13, right? Like that's what happens.
He's 14.
Well, give and take. Couple of years.
Boys advance slower than girls. That's
right.
fine. They develop later.
It's great. What was the next thing that people were saying? Oh, when should you get your hormones done to start hormone therapy?
When you don't feel good.
Yeah. And I mean, the clinical standard is menopause should happen at 51 and a half. Deviations back and forth. When I see some people still cycling at 56, I'm like, you're pushing the, higher end of it. Some people stop cycling at 47. So anywhere between like 36, 37 to 40, any time after that, let's be honest, you should get your hormones checked for sure, just to see where you're at. Obviously, it's 50-50 split really in the medical community on does lab work really matter? And I know our very first episode, we said day 3, and I still say day 3 or day 21 to get your hormones checked. But now it's kind of a split. Like if you don't feel well, maybe you should just be started on hormones. Maybe we are doing too many labs. I mean, labs vary throughout the month. But I still think they're good because I've run a couple different labs on people and their estrogen's through the roof. I'm like, thank God I didn't start you on estrogen.
Right.
I don't want to do that.
Right.
So,
then you want to balance it with some progesterone.
Exactly. So I think like having a baseline is still very helpful for me.
Yeah, I think it's helpful to look at the labs. I think it's also really helpful to look at your AMH, right? Mm-hmm. So how many follicles do you have in your ovaries? Yeah. I think that's probably a more predictable marker. Just, yes, we know in perimenopause, your hormones are all over the place. Your brain is telling your ovaries to make estrogen. So some months you got estrogen, some months you don't. And ultimately, that's going to be variable, right? But what's not going to change is how many follicles you have in your ovaries, right? And if you have less than the standard, we know
you're already in premature ovarian failure, which means your body is already telling your body to release an egg. It's not doing it. Is it a catastrophic event? You feel like shit.
Now, in our practice, we do draw your labs in-house and look at that.
You're doing day 3, right? Or day 21?
Yes.
Yeah. Okay.
But then, it is even
then,
our lab draws are so inexpensive comparatively, but that one
it's expensive. Yeah.
Very expensive.
But even then you get the labs back and it's not just like your labs paint a picture of perimenopause. That is not going to happen. They will always look in normal range. I had a patient the other day and she's going to know when she listens to this who she is. But she was like, the green doesn't always mean fine. And I'm like, the green does not always mean fine. The green means you're not going to be out of the green until you're in full-blown menopause. You're going to be in the green. So the green's not 99% of the time, the green's not always fine. You're not optimal, right? Like you're in this range, but you're not optimizing your hormones. So that's where I think blood work for me comes into play because I can see different trends of what's going on and it paints a whole picture of the person. They're saying this and this and this. Well, is it just like emotional stress, postpartum, change of job, cortisol, thyroid, or is it actually like a perimenopausal situation?
For sure.
So, but if AMH is low, I'm like, well, that was easy because you're there.
Yeah. So are you able to get AMH covered by insurance?
I am.
Okay. Well, then our patients should not be getting their AMH done through us.
Well, yours is like $200 though.
No, it's like $350.
Is it?
Yeah. Everything else is super low. Like we can get all the other labs.
And what if
like
you could just do their labs in
nothing.
your practice and then give them a lab slip? You could make your own. You can get a lab.
We have them.
Yeah, so just send them to lab for their AMH.
Okay, we'll do that. For our people who have, because that's where, like when you come to our office, we charge you $500 for labs. But that's literally because we have to cover the cost of the AMH.
Exactly.
And like the tubes and the supplies and like your nurse practitioner's time, but we really are not making any money. So, which is fine.
But yeah, insurance covers AMH.
So what we should do is just draw all your other labs, because we can get those for super cheap, even the ones that are not covered by insurance. And then we'll send you a lab slip. You go to LabCorp, wherever, get your AMH covered, because if it's covered.
Yeah, my patients.
It's like $350.
I just give them the lab slip. Or I just actually, because I'm integrated with LabCorp, so I just like send them to LabCorp. If they're Renown, I just give them a lab slip and they go to Renown and get their labs covered.
I like that.
And then it comes right back to me, so it's really nice. Next question. Oh, we have a question from Andrea.
They were talking about like the fact that we need to honor the fact that everyone's experience is so different. And so while we start off, right, with like, okay, standard is like an estrogen patch, right? The younger you are, the higher dose you need, 100 milligrams of progesterone orally, BID, which...
No, just at night.
No, I don't know why I said BID.
I don't either.
It's the wine and I haven't eaten.
It's okay. Bedtime. We should have DoorDashed some food.
I know.
That's okay. She's fine.
I'm the worst patient.
100 progesterone at night to cover the uterine protection if you have your uterus. Yes, and then some testosterone, but that varies by everyone. Everyone
but like
varies.
It does. It varies by everyone, and I do think it's important to fine tune it. And you need a provider who's going to walk that walk with you, right? You need somebody who's going to be like, okay, let's try this for 3 months. Come back. Let's see how you feel. If you're off, like maybe draw more labs, or maybe just play with your dosing, play with your patch. Do you need a full patch? Maybe you need half a patch. Do you need more progesterone? Maybe you need 200 milligrams of progesterone.
But I think people are like, how do I know? That's what like the main question.
You don't need to know.
No, like they'll come back because, and I'm going to stress this, it takes 3 months. Like people message me in 2 weeks. Like, I don't feel like this. I'm like, you have to give it 3 months. Your breasts are going to hurt. You're used to not having estrogen. Like you're going to feel a little wonky. You're going to be standing outside in the middle of December and being like, holy shit, I'm having a hot flash. That's normal. Well, we're kind of like getting it into your body, but it shouldn't be normal for the long term. But you really need to give it like that 3 months. Some people will come back at 3 months and say, I have weight gain, my breasts hurt, I can't even lay on them, like all these, all of these symptoms. And so we need to decrease their patch. So it's like not one size. One size does not fit all for everyone.
No.
Almost anyone. Or some people will say I'm doing great on the 100 milligrams of progesterone, but then, oh my gosh, I'm making it from 2 to 4. Maybe that needs to be increased a little bit. So it's just wonky. Like Andrea can bathe in testosterone. I can do 1 or 2 clicks. Like that's just what it is, how our bodies handle it. I love how I say this every episode, how you bathe in testosterone. You're not anymore, right?
But no, I am. Oh. But when I draw my labs, it's still super low.
I don't think labs are as important as we think. Like everybody's like, what do my labs look like? Does this paint a picture of perimenopause? And I don't think your labs are ever going to paint a perfect picture of perimenopause. You have to take your subjective, how you're feeling, how you're doing, your lifestyle, what's going on. You have to take into account everything Hillary said about, am I eating correctly? Am I exercising? That's going to increase your natural testosterone. Eating correctly, it's going to convert some of your estrogen. So it's very complicated. It's not just like, let's give you this and this and this, and you're going to be great. And some people do, but a lot of people it is very complicated.
It is.
So when we have
again, that's why you need somebody who's willing to be like, yes, we're going to see you at 1 month. We're going to see you at 3 months. And I'm here for you. You can message me. You can ask me questions. We're going to figure it out. If you want to draw labs and look at those, we can. If we can go off symptoms, we can. It's all titratable.
100%.
Just like when my patients come to me for Botox, I'm like, I'm going to start here. It's a guesstimation of where we need to be, because I would so much rather you have a little movement than I over-treat you and you feel like a caveman for a month and hate me. Like I can always add more, but I cannot take it away.
3 months.
Which is why I don't like pellets, because
100%. We are on the same page with this.
Yes.
You put a pellet in your body, and it's not just one. We've talked about this in episode 1. If you put a pellet in your body or a couple, your testosterone is going through the roof, and guess what? It's not coming out. So you'll feel amazing for a couple of weeks, and then you will crash and you will feel like shit. That is not across the board. Some people absolutely love their pellets, and I think it's great if you love your pellets. I do not like them.
And here's the thing. It is so variable from person to person, right? So I take tirzepatide, microdose it. I put a continuous glucose monitor on per Dr. Allen's recommendation.
I had mine on too. Did you know my glucose dropped to 42 when I drank wine?
So that's when you drink wine.
When I drank alcohol, and I text Hillary, I was like, what is happening? She's like, well, that's interesting. I was like, I know, right? Like, I was like so stable. And then I drank wine and I dropped to 42 that night.
Interesting. So the first night that I did my shot, they're like, it does not make you hypoglycemic, meaning it does not make your insulin or your blood sugars drop too low. Well, bullshit. Because
did you eat?
Yes. It was my first day on the shot. I didn't even feel less hungry.
It takes like 48 hours.
My freaking blood sugars were in the toilet. They were in the 50s.
Yeah.
For 24, 36 hours. And then they came up and they were straight 90s. And I tried to push it. I drank 3 margaritas.
And you were still in the 90s?
No.
Did you drop?
No, I went up. I went up.
I never spiked.
To like maybe 135.
Yeah.
And then right back to 90s, which is really cool because I was eating, like I eat healthy, but I was like, I want to test this. I got this thing in my arm. So I was like, okay, I'm going to eat some Mexican food. I'm going to have some margaritas. I'm going to like see what happens. And truly it's stabilized my blood sugar. But that first day.
Yeah, it's crazy.
I was like, ooh, should I be in a coma with that blood sugar?
I dropped to 42. I was like, no wonder I have headaches when I wake up.
Like if I was in the hospital and I checked somebody's blood sugar and they were at a 42, I'm grabbing dextrose.
You know what? I did. I got up and I ate some sweets.
Yeah,
I drank some liquid IV. I was like, this is low. Like, and I could feel it. I was like, oh.
So I could not feel it.
But here's the thing about the CGM. Did it scare the shit out of you at 2 a.m. when it started beeping?
So I turned all the alarms off because I was like,
smart.
Fuck you. I'm
Jen and
sleeping.
I thought there was a fire in the house when it went off. I was like, what is happening right now?
You know, I put my phone on silent at 8 p.m. I will not
8:05. Don't call her or text her.
Disturbed while I'm sleeping.
Have you talked to Carrie about that yet?
No.
No, you need to.
Well, okay. I need you to send me an order
She's
for a
telling
sleep
me this
study.
now. 7 o'clock at night. I'll do that tomorrow. Right on it.
Thank you. Love you.
Love you. We totally got off topic. These 2 episodes are just a tangent.
Okay, let's talk about what we did to your face.
Oh, perfect. Okay, so love it. You can't probably see in the. Is it that bad? You can see in the video. You think?
I don't know. I guess we'll find out.
I guess so. So I had a mouth surgery like 3 years ago, like a lower lip surgery. It was great. It wasn't. It was absolutely horrible. I feel like mouth pain is really hard, and I feel like I've been through pain. Like I felt my C-section. It was a little rough. Recovering from mouth surgery is not fun. Anyways, they resected my inner part of my lower lip to do a biopsy for something, which ended up being totally fine. They left it open so that it could heal. So I got all these adhesions in my lower inner lip, and they, subsequently have made my lip numb, but like hurt at the same time. Like when it's cold, it hurts. Like it's like a weird, like I can feel the weather coming because of my lip. Just take out your lip.
It's like I have ESPN or something. What movie was that from? Anyway.
It was from Mean Girls, wasn't it? It's like to stick out your lip and see what the weather's going to be like. You know what? It's rainy today. Anyhow, Andrea was like, humidity of 52. Andrea was like, look, I just put myself on Andrea's schedule every 3 months just because. She's like, look, I have this brilliant idea. I learned this 2 weeks ago, and I'm like, cool, let's do it.
Let's try it.
Let's do it. So she numbs me here down. It's supposed to numb here down, but my eyelids were numb, right? I am numb. Like my entire face looked like I had a seizure. I was like, that's cute. She takes a cannula and scrapes my. What did you do?
I was doing subcision of your.
She drew my blood. I had a lot of pokes that day. I was very beat up. This was not even a week. Almost.
Did you feel it?
No, I didn't feel anything. Andrew's great.
Okay. So I had this decision. I was like, okay, I've done.
She's heard me bitch about it enough that I'm like, oh yeah, this lip. Oh my
and
God,
I've done her filler before, where I kind of like got in there and tried to hit her mental crease.
And it's great when I'm like swollen, but then
she was like, "This feels so much better," and I'm like, okay. I think we need to do some subcision of the lower face, and then we're going to throw in your own PRF, and we're just going to like regenerate some new collagen. So I numbed her up so she couldn't feel anything. And
very numb. Not even my eyeballs I could feel.
Took a cannula. I took a cannula.
We're laughing this entire time she's doing it. Like, oh, this is great. This is a new experiment. See how it goes.
Well, I knew what I was doing.
You knew what you were doing. Yeah.
But so I just got in there and I broke up all those adhesions.
What do you do when you do that? Let's tell them the process of how you do that. You make a hole in the face.
So I make a hole with a needle in a couple spots, probably like 2 or 3. And then I take a cannula, which is blunt. It's not sharp, but it's long, like 1.5 inch, 2 inch, depending on what you want to do. And you just go in and you get up under the dermis.
It's like she's painting a paintbrush.
And I just do a fan.
Doing this.
And it's breaking up any adhesions, right? We as we get older, we get all these adhesions on our lower face and around our mouth, perioral area. And I was like, okay, let's do some PRF in there. We're going to add a whole bunch of new cells. We're going to trick your body into thinking there's an injury here, which there kind of is because I'm breaking up a bunch of scar tissue. And then we're going to create new collagen and elastin, and it's going to like soften up and it's going to feel better. And that's what we did. And then
on both sides,
because she was super numb and I knew I was going to bruise the shit out of her, I was like, you're going to be really bruised. I'm sorry about that.
She said, I think you might be a little bruised.
I knew going into it.
I look like I got beat up by a wrestler.
It's fine. You're fine.
Here's the thing.
Did you die?
It feels so good. I feel so much better. It's phenomenal.
Good.
I can't feel it at all. I can't feel my lip at all.
Worth it.
And now my lip looks really good.
You mean you can't feel the pain?
She put a little
you have sensation in your face.
Oh,
but
no.
you don't feel
I'm talking about the adhesions that were like pulling and like causing all that discomfort are completely gone. Put a little lip filler in the bottom. Little lip flip on the top. Couldn't even feel it at all. Little Botox lip flip. That thing hurts like a bitch, but when you can't feel it, it's great. And yeah.
So when I was in there, I knew I was bruising her, and then I'm like, I gotta do some recovery work here because she's gonna be pissed. And so I was like looking at her lower lip, and I'm like, yeah, it's looking a little dehydrated. So I was like, let's put a half syringe in your lower lip so it feels like nice and hydrated. And then while I was at it, I was like looking around. I pulled her lip up. I'm like, you have a little bit of old migrated filler from way long time ago.
4 years ago when we did
in the mucosa. So I just got some Hylenex. We dissolved that. We did a lip flip. Yeah. And she couldn't feel any of it. No. And it was perfect.
It was wonderful. I literally couldn't feel any of it. Like I would take that every day over getting like normal lip filler. Yeah. Because you literally can't feel it. You're just like sitting there.
Yeah. And honestly,
but when she did the breakup of that looks really bad on camera.
It's like liposuction, but in your face.
No, please don't do that. That looks really bad. Don't do that. That's not okay.
But it's, you're in there. You're like breaking it up.
Travis was like, yes, please. So when she did that, and then she took PRF and she injected it. So then hopefully when it heals, it will heal much differently.
Yeah.
So TBD, but for right now, 100%. If you have adhesions from like a surgery, go see her and break it up. It's so great.
But in general, so many women say, I hate my lower face. I have this like the marionette lines, right? We have this like turning down, and we can treat it with toxin, right? We treat our DAOs, we treat our platysma bands, but a lot of it is just you get this kind of adhesions. And so you can actually go in, break that up, and then you can put PRF, you can put filler, you can do all kinds of things.
And I really like that it was my own body, so I wasn't putting anything foreign into my body, which was nice. Except for, a little kiss in your lips, which is...
It's fine.
I was going to say something about Jupiter, but I won't.
No, it's fine.
It's great. I love it.
Our preference is the most bioidentical fillers. Mm-hmm. So we want something that's going to behave predictably, that's going to be most like your natural endogenous hyaluronic acid. And so
Right.
that's why we use Restylane. Like, I have no problem saying I love Galderma.
I love Restylane.
I use Restylane all day, every day.
For autoimmune diseases, you're not supposed to use some other products because you can have a cross reaction to them. And since everybody knows our lupus, so it's like that we definitely stay away from that. We try to go as natural as possible, which I very much appreciate because I never want to look overdone. And so, or, you know, nobody wants to look done at all. It's like a taboo. But at the same point, it's like, who cares?
Well, and
this
here's
was
the thing
so
with filler.
magical, like just to like use my own body to do all of this.
Yeah, and with filler, you have to be intentional because it's like fillers are like paintbrushes, right? You have all different kinds of brushes, and it depends on what area of the face you're using them on. And some of them you want to have expression technology. So when you're around the mouth in an area that moves all the time, you want the filler to be able to move. Sometimes when you're on bone, you want something that's going to be a little steadier and firmer and like not move and like stay put. But I love the Galderma portfolio and all the Restylane fillers because I know it's going to behave the way I want it to. If I need to dissolve it for some reason, I can dissolve it easily. Some of the other filler lines, they're heavily cross-linked, which basically means that they put these little bonds between the hyaluronic acid. And so it's harder for your body to break it down. So it does last longer. But also, if you have a hyper responsive immune system, which Stacy does because she has lupus, your body's more likely to flag it as foreign and attack it. And so we do not use those fillers with our autoimmune folks. And me, myself, I've had that happen in my own face where I get sick and my body will swell up and that filler will hurt.
Especially with COVID. Remember all the people that were like randomly swelling because of the filler? And you're like, oh, because their body's just attacking it, you know, which isn't a bad thing. I mean, we didn't know, but.
So I won't use that filler anymore. And I just feel comfortable. Like if I'm not going to put something in my own face, you better believe I'm not putting it in 100%. Your face.
Yeah. So I think that like with the, you know, stigma of filler, it can be done so nice and naturally where like, you know, and people might be like, oh, you look refreshed, but you shouldn't be like, oh, I can see you got filler. Like that shouldn't happen. Like it should just be very natural. So, I mean, I'm definitely plugging Andrea. There's nobody I would let touch my face.
Thank you. I love you.
Maybe Riley.
Riley is great. Taylor is amazing.
Yeah, oh, and Taylor, I love
They're all trained
so
by
nice.
me. We all do it the same way. But
they're so nice. I went and worked there last Wednesday before Andrea did. I was like working in her office. I'm like, I'm coming to work here. And they were just, they're so lovely. And Roxy's just my heart. So
I know we have
just a nice place to be.
We have a saying in our office that culture is queen.
Yeah.
And
it was such a nice place to be.
Hold by that. Everybody in that office is just so incredible.
Dan's like, why are you working at Ritual today? I was like, because I want to.
Why would I not? So many of my patients are like, can I just come hang out here? I'm like, yes, girl, you can.
I want to.
We have an espresso machine for you. We got bubbly water, whatever you need. Sit down. Here's the Wi-Fi password. Sit, relax, do your work.
It's great.
We're already like over.
But you were very busy last Wednesday. But I think that was abnormally busy because most people aren't there that Wednesday. But everybody was there, and then I was there on top of it, and it was just. It was so busy. There was a lot of people. Well,
there. Even today, I was like, we've grown out of our space. We have 6 rooms. They're all full.
Yeah.
Well,
I think just
I have
because
to like get another.
Like, some of it shut down because of the fire.
No,
it's not shut down because of the fire. Like that back room.
Only Nicole's room was closed. Well, that's like an esthetician room, right?
Still.
And then the utility room.
Yeah, that's true.
We're full. Like today, it's full. So I'm like, I don't know. We got to expand. We got to open up a second location. I don't even know.
Oh, a second location might be fun. TBD. All right, next question. Next and last question. Sorry, I put you on a timeline.
She looks at me.
Girl. My pants are dry, I think, but I'm still sitting in water.
This is a good one. How can I tell if I'm losing muscle versus fat on a GLP-1? Granted, this is not hormone, it's GLP-1.
So remember our GLP-1 episode was our second episode. So if you want to know fully about GLP-1s, watch episode 2. Andrea and I are very, very much into microdosing. So anything below 2, and we're just going to talk about tirzepatide because that's pretty much what we prescribe. Anything below 2.5 milligrams is considered a microdose. You should not lose muscle with a microdose if you are doing it correctly.
Well, and here's the other thing. You need to be getting your protein intake 25 to 30 grams of protein at each and every meal. You also need to be weight training. Get up off your ass. Love you, but do some weight training.
I literally am sitting here and I'm like, thank you, Hannah, because I can't move today. My back hurts so bad. Like I was there yesterday and I was like pumping it and I was like, I'm going to die. I'm pretty sure I'm going to die.
And you don't have to go that hard.
I didn't go hard at all. I just think don't.
You're out of shape.
Yeah.
It's fine.
I was in Australia.
It's fine.
I sat on 49A for 28 hours.
We were in Denver and I went on a hike with Riley and Taylor. And these bitches, they go up the hill and they're like fucking smoking me, excuse my language. And I'm like, okay, I'll meet you there. Don't wait on me. I'm in my 40s. I'm old. And then, but like my ass cheeks were sore.
Yeah.
I'm out of shape. That is
our goal. I mean, I'm going to I've got like 4 days this week. I'm back at it. Now that the kids are back in school, I feel, you just heard us talk about the summer. It was crazy, but like back at it. Got to do it.
Yes.
Hey, if my almost 13-year-old daughter is out training me,
we got a problem.
So we got all the stuff. We're set up. We're back at it now. So got to weight train because we're busy and we're doing it.
Yes. So weight training, protein intake.
But you also lose a natural amount of muscle mass the older you age, right?
Yes.
Like my dad, sorry. He got this, I don't know if it's a book or like a recommendation he found online about what you're supposed to be doing at your different ages. He's 70. So he makes my daughter and myself stand in the corner on one leg with our eyes closed. You are supposed to be able to do that for a minute. I think he got to like 40 seconds or something. Paige got to like over a minute. And I mean, so did I. So I'm great for a 7-year-old. But it was really cool about like, what are the recommendations for a healthy movement of your body at different ages? And I think you're supposed to do like 11 push-ups at 40. And I think I can do 4. But it's really cool. So I think like, cause we age and we lose muscle at, just for aging as well.
Yeah. I will say though, even just doing yoga because of my back, like I was only doing yoga like 2 or 3 times a week. And when I would go get my massages once a month, my massage therapist was like, you are gaining muscle. Mm-hmm. So it's like
your calisthenics, right?
There's so many ways of getting that muscle, whether you're weight training, whether you're doing Pilates, whether you're doing yoga, whether you're walking, hiking, whatever, biking, just move your ass.
Yeah.
Essentially.
And I think for the girls that are doing it or the men that are doing it and are losing muscle, but they're microdosing still, then we got to look at the diet.
Yeah.
We're losing micronutrients or protein or something that we're not able to build muscle.
And we do have something really cool at my office. It's called a shape scale. It spins around you. It takes thousands and thousands of photos.
I won't go on it yet.
It's traumatizing, a little bit traumatizing,
yeah.
But it gives you like a 3D avatar of yourself. You can see yourself from every angle. It gives you every measurement on your body. It tells you your
Does it tell you your boobs too?
Yeah.
That's interesting.
It tells you your muscle mass. It tells you your subcutaneous fat, your visceral fat, all the things, your basal metabolic rate. It gives you all your measurements. And every month that you come in, it will compare month by month.
How much do you charge for somebody just to use that machine?
I don't
Let's
know.
say it's not packaged with the GLP-1 program.
No, hold on. Let me look on my online booking. So you can book it online.
You can just book it online.
Yeah. So you can do a membership where you come in once a month and
but that is cool. So you can see if you are training, how you're doing.
And
I think it's like people think it's just how you look, but like you're changing on the inside a lot more.
Oh, for sure. And it will show you. Okay, so you go on booking link, you go to shape scale, you say select a professional. It doesn't really matter. Just pick any of us. It's $60 to come in.
Month?
No, like per thing.
$60 every time you go in to get on the shape scale. Okay.
Yeah. Or you can do a monthly membership. I think it's like, I don't know.
Yeah, just
it's not bad. It's like
if you want to do it.
$100-ish a month, right? So it makes more sense to do a monthly membership because then you can track yourself over time. You can see, and it's cool because not only will it give you your measurements, it'll give you like a heat mapping of your body side by side. The blue is where you've lost. The orange is where you've gained.
Oh yeah, that's rough. Don't go on it in December. A little Christmas.
It's cool because like if you have a bunch of like your biceps are orange, your calves are orange, your butt is orange, you know, you're like doing the right thing, and your waist is blue. Like that's what we're going for. I will say what's really cool is we had a patient that like didn't really lose any weight, and her month to month scans, she had her whole, like all over her body was blue. So even though she didn't lose any weight, we could see her loss of inflammation.
Well, and did her in her visceral fat too, right? Like, did she gain muscle and lose fat? Can you see if you gain muscle and lose fat?
Yeah, it'll tell you like your numbers.
Yeah.
But like visually, like, and I have a lot of patients where they're like, I'm not losing weight. I'm not losing weight. And I'm like, yeah, but look at because I take pictures of their face every time they come in. I'm like, look at the difference in your face.
Yeah.
You can see the change in swelling and inflammation. It's insane.
I mean, yeah, yes, do that. I got to say, these freaking GLP-1 microdosing. I had a patient the other day that said, oh, I'm just so swollen. I'm so swollen. I have so much inflammation. My TPO antibodies, which is Hashimoto's, which is the big thing right now, because it seems like after COVID, everybody has Hashimoto's, right? TPO antibodies go up. You feel like shit, but there's not a medication to take. Microdosing trizepatide or doing a GLP-1 like trizepatide or the peptides. One of my patients said she lost 7 pounds of inflammation overnight. She peed out 7 pounds of water overnight and her rings fit. I was like, that's incredible. Usually it takes 21 days to see the inflammation go down, but like overnight.
I notice when I take my shot, I will be up.
Yeah, because you do so much energy.
In the middle. No.
Oh.
In the middle of the night, peeing.
Oh, peeing. Oh, I feel like it's me energy.
Well, yeah. Energy. I do have more energy. But like, yes, every time I take a shot, I'll be up like all night.
Are you taking it at night?
No.
Oh, okay.
Well, maybe. It just depends on the day, Stacia. I'm a very busy woman.
Takes 30 seconds to take the shot, but it's okay. Anyhow, take your shot in the morning, not at night.
I think I normally do.
Yeah, you probably do.
I probably
Anyways,
do.
you're peeing, like there's so much inflammation and like retention from hormonal shifts, so.
Okay, it is now 7:30. We have been here for 2 hours recording.
What? That's a lie. We haven't been here that long because it took Andrea 15 minutes to find the place we recorded at 9 times.
Snorted my snot on camera. Sorry about that. Allergies.
It's okay. All right. Well, thanks for the
We're done.
2 episodes of Tangents. We will be back with. Did we already say that on this episode, or was it the last episode? Was this one?
I think it was this one.
Allie Janice. Oh yeah, it was with Allie Janice from Great Basin Orthopedics. With
probably Hillary Allen,
and
Dr.
with a super
Hillary.
Dr. Hillary. And then with a super fun wine thing. So stay tuned.
Cheers. Cheers.